Hello, my name is Jocelyn Estrada, and the drug I chose for my presentation today is Devil's Breath. What is Devil's Breath? Devil's Breath is a drug also known as scopolamine, which is a substance that is acquired from a plant that actually contains scopolamine. As you can see, this is the picture of the plant I mentioned. The plant comes from a tree mostly found in South America, and the name of the tree is called the borrachero tree, which is a Spanish word. This tree is mostly found in Colombia, which is also one of the main reasons why they have a big drug problems with scopolamine over there. Fun fact, actually, they used to mix this drug with morphine, and they would combine it together to give to mothers during childbirth. Because basically those two combined will put the mother's pain at ease during the childbirth, so they wouldn't really have a recognition of, the pain during it, and they would go into this state called twilight sleep, which I will later mention. It was also used for indigenous, spiritual, um, medical thing, and as medicinal use. This actually transitions to the next topic, which is when the abuse of the drug came to be. The abuse actually came during the time when they were giving this to the mothers. Doctors found out that during the twilight sleep state, when they would ask the mothers some questions, they would answer like truthfully. So then this would transition to it being used as a truth serum for interrogation, but due to like the severe side effects that would people would get from this, it had to be eventually stopped from it being used. They would get fevers, headaches, and many other effects from it. The abusive mechanism of action, it used the acetylcholine receptors from the central and peripheral nervous system, and due to that being affected, it causes the amnesia, state of disorientation, and zombie-like state, which is basically like when your body is looking out and above and you're not really, here, but like your mind is somewhere else. The scopolamine interferes with the neurotransmitters of acetylcholine, and so anything like memory, muscle control, or the parasympathetic nervous system and nausea is interfered with. And then as we transition to the other side, uh, due to all those things being interfered with, the neurotransmitter acetylcholine, it causes effects to the body. So it can cause like confusion, where you don't know like what you did or where you're at. Amnesia, basically you forget a lot of things, and hallucinations and behavior changes, which is where they would start to imagine, that they did something and then they didn't, they find out they didn't, they would get angry because it's like they would say, no, but I did it, you know, examples like that. The immune system isn't really like a hardcore target, but it is still impacted by the drug. Um, because of the high fevers and stress and inflammation from the drug, it does still affect the immune system. The major components that are involved with the stellophamine, sorry, uh, affects the immune systems are the acetylcholine, the muscular acetylcholine receptors, and pro-inflammatory cy cytokine, cytokine. I don't know how to really pronounce that, sorry. And due to the scopolamine blocking the acetylcholine receptors, it weakens the immune system and the anti-inflammatory control, which literally causes inflammation in the brain and in the body, which is what I mentioned. How it's not really like hardcore target, but it does still impact the immune system. Some facts: it is actually not a DEA scheduled drug, like controlled substance, but it is an FDA approved substance, but only for medical purposes. So, as you can see, I do talk about how they have uh changed the way they use it into, I don't know if you guys have seen the motion sickness patches. They do come in different forms. So, they which is why it's FDA approved only when controlled. I put a picture of the Borugada uh photo that I was talking about of the flower. How it's a very, caution thing to be written. It actually got its nickname Borundaga due to its tasteless and ordinance powdered form, which is due to this, which is actually very bad. It has been abused and it started to be used as a tool to spike food and drinks. And because of the effects that it gives you, which is amnesia and, the forgetting stuff, they started using this to spike, and there has been a lot of victims due to this. Although there are some good things about the drug where it helps with nausea and, stuff like that, there are some downsides to it as well. And, you know, like all drugs, there's the good and the bad. And that is all. Thank you.